live? I haven't done that yet. I like to do that every once in a while. We're live.
We're live.
We're live. All right. Good
Hello.
morning, everybody. Welcome to a special episode here on the Digital Classroom Dental Podcast. I am live in Las Vegas at Christine Taxon's Dental and Medical Insurance Extravaganza. This is day 2, and very, very excited to have the opportunity to not only spend time with the great companies that are here that are sponsoring the event, but also some of the speakers. And I have with me this morning, very excited to have JoAn Majors, who's with me. And yesterday, she spoke on Beyond the Benefits, turning your patient's oh no into a woohoo.
Woohoo! It's a little more excitement than that.
That's
Absolutely.
why you were presenting
That's
it,
exactly
which is great.
right. That's exactly
Well, thank
right.
you so
It's
much
been
for
great.
coming on the podcast. It's a
You're
real
welcome.
pleasure, and wanted to have you come on, talk
Yeah.
a little bit about what you spoke about. You've done so much in dentistry, what have you, and just excited to have you. So thank
Well,
you.
I'm glad to be here. Thank you for having me. You know, one of the things that we know for a fact happens in dentistry is that we can't lose sight, whether we're talking about insurance or whether we're talking about technology, we can't lose sight of the fact that it's still a person attached to the tooth.
Right.
And I think that most of the training and the speaking that I've done in the industry over the years has been about that relationship and establishing the relationship first so that it's not something that is secondary.
Right.
In other words, we look at the old case acceptance model, and what we know about the old case acceptance model is we started with all those things that have come full circle again. You know, it's important that we know the plan. It's important that we know their medical history. It's important that we know X, Y, Z. These are all transactions, okay?
Mm-hmm.
And so we choose, like my good friend Dr. Josh Packard, who's a sociologist we work with, we choose to be transformational, not transactional.
Right.
So to do that, it's like anything else that we do well in dentistry, we've got to have a system. And so we worked yesterday on the system, which is the cycle of 6, which is about building the relationship, the lifelong relationship, that actually allows us to put insurance money and those things here. And once you and I have built a relationship and you trust me and we can move down the road together, then it's time to talk about all those things that could be what we would have considered, 10 years ago in dentistry, obstacles. And we
Right.
just don't believe it has to be that way anymore.
Right. So I'm curious. You bring up a very important point. It used to be like that, and then it kind
Yeah.
of got lost a little bit.
It did.
And now it's coming full circle.
It is.
Any ideas, thoughts? I mean, you've been practicing in dentistry for many years. How did it get like that? Like, why did we lose our focus a little bit?
Well, what I believe is that history kind of repeats itself. And I think about when insurance, since we're at an insurance meeting, when insurance started in the late 50s, early 60s, these oil and gas companies wanted a little bit of extra. When we're from the South, I'm from Texas, and in Louisiana they call it the lagniappe, the little bit extra. So I think the oil and gas companies, or we know for a fact, that they thought if there's some other little something we can give them, we can get these big contracts. That's kind of how it worked. And so as I talked about yesterday in my program, at that time, if somebody had $750 or $1,000, that could help them get 4 crowns and a couple of cleanings in a year. And people came in and said, I just want to do this year what my insurance will cover. And we know now that in my husband's practice, when they come in and say, I just want to have what my insurance will cover, we have to use the word pictures and the things that help them understand and go with us to where we are. So we'll say, which one tooth would you like us to look at? Because in today's economy, although these maximums really haven't changed, what's changed is the fee.
Right.
And the cost of doing that. And I mentioned yesterday that my husband regularly says this because, we have a lot of technology and a CT scan and a lot of these digital x-rays and that sort of thing. We've almost outpaced our patients' ability
Yes.
to pay for that kind of high-end care.
Yes.
So we really believe that although those things are important, that was my beyond the benefits, like let's get beyond that, let's build a relationship, and then we can go down the road together. And we did. We do Secret Shopper on every audience I speak to. I've been doing it since I taught at the Mish International Implant Institute. Probably we started doing it 20 or 22 years ago. And the really interesting part is no matter how many times we do that, and we don't record them, we don't do that to make people feel bad. We do it to have them understand the value of what we're trying to teach that day. Mm-hmm. Because just like we go in with a patient in our practice and we interview this person and we want to know what they want to walk away with and what they're looking for in this appointment and what's going to make this a good investment of their time and money. That's the same thing I do with an audience. Mm-hmm. And it's the same thing that we invite people to do with the system. So for us, when we do the Secret Shopper, and I think we shopped 16 of the practices that are that are represented here, and of 16 practices, only I think it was 13 gave their name, and not one of them asked our caller's name. So for me, that's about the relationship. When you and I sit down, we shake hands, and we do what?
Right.
JoAn Majors.
John Stamper.
That's what we do. That's what we call it, our telephone handshake, because that is so critical. We believe in building the relationship, that we're not in network with any plans in our office. That's not to say that we brag about this. When my husband bought this fourth and final practice, he said, "Okay, we're in for a challenge," and I said, "Tell me more about that." Which anybody that knows me knows I'm going to ask some questions. So I said, "Tell me more about that," and he said, "Well." He said, "This guy's an amazing dentist, but we're going to put every test. We're going to put a test to everything you and I have ever taught anybody and everything that you've ever done from the road." And I said, "Tell me more about that." He said he's on 32 plans, JoAn. We'd never been on a plan. So we had to put a system in place because we don't believe people fail. We don't believe that team members inherently want to go out and, cause a problem for the practice. What happens is doctors put people in these seats and they don't give them any training.
Sure.
So we believe that you take good people with great attitudes, you plug them into some great training, and they'll perform for you. And that's how we've done what we've done. So when we went through this thing of now there are 32 plans, we knew that we had to have a plan for it. So we developed a system for coming off the plans, and in 6 months we were off all of the plans but 2, which was we're in Bryan College Station, which is where Texas A&M University is. So the plan that Texas A&M University had and the plan that the hospital, which is a half block from us or 2 blocks from us, was on, and we came off those in a year. And we had produced and collected 5 times what he had the first month in 8 months. So we believe it's systematic. We believe it's about the relationship, and you've got to have the technical aspect of it. You do.
Right.
But we believe in today's economy, we're back in a relationship economy. My husband's father practiced dentistry almost 40 years. Never wore gloves, never had an autoclave, and never worried about whether or not he was going to be compliant with an insurance company, much less, what kind of technology it took to deliver the dentistry we do today.
Right.
So I think it's different.
It's interesting you talk about practices being able to catch up with the technology, because I think we see that in a lot of industries, right? I think that you're never going to put the brakes on all of the different products and services that companies create. That's what innovation is.
It's true.
And I think that's where a lot of the frustration comes in, and it's education, like you mentioned, and getting back to the basics of bringing people up to speed on that. And I'm sure it's the same thing with insurance. I mean, I'm sure in a lot of cases, I've seen it in the medical field in different parts of my career where technologies were put out there, and the insurance companies were just like, it's not that they didn't see value in that, but they were like, this stuff is coming to us so fast, we don't know where to put it. We just don't know where to put it, right? And so there is an element of not everything comes to market and not everybody learns how to do those things in market all at the same time, and I think that's where frustration comes in.
You're right. And I think one of the things that we do, and one of the things that we do with the business and the trainings that we do, is we really focus on having team members and doctors understand the words that work today, because you just won't hardly hear anybody in our office say insurance. If they say insurance, we actually correct them in a very respectful and kind way. We'll say, "Oh, you mean benefits?" And they'll say, "Well, what do you mean?" And we say, "Well, what we know today is that most people really in dentistry really don't have insurance. It's really more like what we'd call a benefit or a coupon. In other words, about half the population doesn't even have a benefit, so you're blessed if you've got some benefits. Now, here's the other half that do have some, but when they do, many times it's like a coupon. So, for instance, John, if you got a coupon and you loved salsa, because when you're from Texas, you love hot sauce, right?
Right.
The problem is the coupon that you have for salsa, it's not for picante sauce or Herdez salsa. It's for a no-name brand, and you can only get it on Sunday, and you have to stand on one foot at this grocery store to get it. It's the same thing, and so having them understand that using the right words, that's why we say the often misunderstood and overlooked soft skills. That's what we do, and it's like the soft skills that we teach the team help the doctor get to do the dentistry that they've been trained to do.
Sure. So that made me think about a time, I'd spent some time in some practices, and one of the things that we worked on with the teams in those regards was a very simple statement, and I've shared this over the past, which is when treatment was presented, the way that a lot of these practices presented it was, here's what you need, here's what the cost of it is, and the good news is that your insurance or your benefit is going to cover a portion of that.
Yeah.
That little thing, JoAn, it was amazing. To your point, when the team presented it just in a little bit of a different way,
that's exactly right.
The patient realized it was kind of like a benefit or a coupon because they didn't go into thinking at it or expecting that insurance was going to cover all of it.
Yeah.
And when it was framed in a way that was the good news is it's going to cover a portion of it.
Sure.
Then it makes you feel like, okay, at least it's better than nothing.
Right, absolutely. Well, and one of the things, John, that we really, really focus on, even when we're training, because, it's not that doctors, I don't think, want the training, it's they don't have access to it, and a lot of team members don't want to go. So it's the reason we work with a lot of different consultants, because my passion is speaking and inspiring from the front of the room and working in our practice. It's why we did our online learning. But one of the things we learned from this was that we want to shift the conversation. If they call and say, do you take Delta? Or they call and say, whatever, how much does this cost? We really want to shift that from this fee, this money thing, to this relationship. So we work through how to say, I'm sorry, that's a great question. I'm happy to answer your question. Again, my name's JoAn. I didn't catch your name. Well, my name's John. John, let me first say, you've called the right place. Because we want to ensure that person. We want to offer hope. We want them to know that they've called the right place. Then we go through these things. Will we answer the question? Someone asked me one day, will you answer the question? I said, yes. But when we come back to it, we ask the question and we turn it around. We'll say, and it's on our form. I mean, we want everybody to understand, so you just kind of follow the form. It's not a script, although we know scripts work because we've all crowded a movie, right?
Right.
It's a script. So scripts work in the sense that I tell them not to listen to my thoughts and not my words. You've got to find your language to get here. But when we say to somebody, now I've got this, your appointment's Thursday at 10, we look forward to seeing you. Now let me ask you a question. Do you have any benefits? Because we've got a benefits specialist who we will have do a complimentary benefits analysis for you so that we can ensure that if there's any benefit you've got out there for these treatments, we're going to get every dime of it. Right. So, I mean, it's just shifting it and being able to use soft skills, I believe, to have them value where they've called more than anything else, because that's where it starts.
Absolutely. So talk about this meeting. It's the first annual.
It is.
You were obviously asked to speak, and a lot of great feedback on what you spoke about. But share kind of your thoughts on this meeting, the relevant value of it now in the industry. And I'm curious on that.
Well, I think it's really timely. Christine's brilliant, and she and Teresa Duncan I've known for years. And one of the things that she did, almost, I think, without even realizing how brilliant it was, is because there is this, the meta scare, the medical scare of what's going to happen, what are we going to have to do, what are we not going to have to do. She's got speakers here who are not only great speakers, but I haven't heard one speaker that wasn't extremely approachable. And you podcast with some of these people, with all due respect. You go to meetings where you don't, it's like, can I touch the coat? Because I can't get any closer, right? And everybody here has been so open and so honest and so available. Yeah. And I think that they're onto something really great. And I think dentistry will benefit from the people that she's brought in that will, number one, like something like I do, which is like, I want to talk about how to take the subject away from that. But we do have to talk about it. And then when you think about how many of us have an aunt, uncle, or cousin, or somebody that's got diabetes or got rheumatoid arthritis or whatever, and you're listening to this stuff in the room and you're thinking, we can now serve our patients better, then you don't think of it as like the burden of insurance. You think of it as the opportunity to serve in a better way.
You have confidence, right? That's the one thing. Education makes us more confident.
That's
and it allows us to be able to handle a lot of those challenges out there that exist and give us a direction. So real quickly, before we do some fun questions, which I'm excited to ask you, the Soft Skills Institute, which is something that you co-founded, very excited. Just share a little bit how people can learn more about it and things like that.
We are, for 14, 15 years, I had a company called Dentistry by Choice, and we reframed, and as a lot of people have to do, right? You have to reinvent yourself. And what happened was, for years, they had joked about, they called me the verbal word surgeon. And so when I met Dr. Packard, who's a sociologist, and remember, sociologists study people, groups of people, and what they do, he said, JoAn, you are onto something. He said, what you teach, he said, you make application with it, where many people, we've met a lot of people in the industry this way, where many people are teaching something because they know it works in one industry or another. This is something every industry knows works, really except ours, because we've been so caught up in the technical aspect of it. And I remember years ago I was being introduced in a room, and Dr. Mish said, what good is all the clinical training if no one chooses a treatment? And so what we do is we really work to help the team and the doctors have greater soft skills, which creates value, and value creates the relationship. Then we have trust, and only after you have value, relationship, and trust can you become the authority again. And so I think that for us, it's exciting. We do a couple of 2-day events a year that a lot of the other clinical training groups will send people to us because that's our niche. That's what we do, and we have application with it. So it's not just to teach it; it's to how we have application with it. And then, we have an online learning that is in short videos with quizzes because today's team member doesn't want to spend a lot of time doing that.
Right.
And so we've seen a shift that way. And so we had to make it where a doctor could have like an hour-long team meeting, go through, one part of the content, cover it, finish it, do a quiz, and move on to the next piece. Because we know, in my husband's practice, we know that if we say, now I want you to watch this 45-minute podcast, and then we're going to get together and the next question is, will you pay me? And that's fair. It's fair. So we wanted to make it where if somebody took a break, if they took, 10 or 15 minutes, listened to a short video before we had our meeting next week, and we listened to it again, then we have all these thoughts that come together, and it works better that way.
Absolutely. I love that. So, question for you. If you had the opportunity to spend an hour at lunch or dinner with a celebrity, who would it be?
Ooh, that's going to be tough. Celebrity. I'm probably going to say Warren Buffett.
Okay.
There's a real admiration for somebody who has done what he's done, built what he's built, still lives in the same home that he started in. And I am one of those people. My husband drives, we laugh about, they'll say, oh, I guess that's Dr. Major's vehicle out there. And he's like, nope, that's my team members, or that's somebody else's. He says, I drive the used Ford F-150 over there. And we kind of laugh about it. But I admire and I respect somebody who has understood the value of what we earn and how to actually multiply what he's done. I think he's incredible, and I'd love to find out, like how does he, when he wakes up in the morning, like what does he think? Does he? Really and truly, it's like, what do you think? Because I get up thinking, okay, well, what am I going to do today? How am I going to get? I've got a to-do list, and then you have to have the other one that's bigger, the to-don't list, right?
Yes.
Because we have so much technology, and I think we're almost, we're almost overstimulated.
Yeah,
and it's
true.
like one of those things that he grew up in a simpler time, clearly.
He did.
So I think that, I'd like to learn from somebody who's built a wealth like that and gives back the way he does.
Absolutely. So I can't say this for certain. If I took one guess, I would say that maybe the first thing he does in the morning is read the Wall Street Journal. But I'm just saying. I don't know that for a fact.
And see how he's doing.
That might be a good chance. Okay, so you have a lot of energy, which I love. Favorite day of the week?
Favorite day of the week, Monday.
Okay, I figured that.
Monday.
Because you look like you're ready to go. You enjoy the weekend with family and then ready to go.
Yeah.
Awesome. And then as we close out here, when you look at where dentistry's going, one thing you're really excited about?
One thing I'm really excited about is I think, and we talked to you a little bit about this. I have a co-host, and we're debuting a podcast called SpouseTales.com, because you can't make this stuff up, and the book's not finished yet. I'm really excited about that, and I'll tell you why. I podcasted with Howard Fran maybe a year and a half ago, and it was interesting. He was talking about that almost 30% of the people that get out of dental school are engaged or in a relationship with somebody that's in school. And Kathy and I, my co-host, we have an area that we call Life Before Wife. We both had a career. We aren't just the doctor's wife or spouse, male or female. And what's interesting is where I see these associateships and things where you'll see a male doctor and they'll have a young male doctor come in, based on their Colby and their personality style and everything. Sometimes they work, sometimes they don't, but there's always a little bit of that ego thing there. Love the men in my life, but there's a little bit of an ego thing there. It's not that way with these wives, because it's interesting. It's one of the reasons we decided we were going to do this, because we've made so many mistakes. We've spent so much money on consultants and coaches and things. Some of them work great. Some of them we really can't believe we did it, but it was at the urging of, let's find out, because we're always willing to learn. We want to keep learning. And so Kathy and I are really excited, because there's nobody who mentors the spouse.
Sure.
Nobody mentors the spouse.
Right.
And I've even had people who say, well, I'm going to listen to it because I want you to be my spouse. And I say, well, I'm married to one, not married to another one, just saying. But they say, no, we're looking forward to learning from you guys because clearly it's the inside scoop. We both still spend time in the practice.
Yeah.
And that's what I'm looking forward to. I'm looking forward to an opportunity to really give back to an industry that's been amazing for me.
Well, I can say this because it has been an awesome journey to do this podcast or what have you, and I'm excited for you guys.
Yeah,
I think you'll
thank
do a
you.
wonderful job, and certainly it's a topic that I'm sure people will want to be listening to and
Yeah,
tuning into.
I think so.
Best of luck. This has been awesome. Thank you so
Very
much
good.
for coming on our show, and good luck the rest of the weekend.
Thank you.
All right.
It's glad to be with you, and we look forward to seeing you on the road.
Thanks,
Thank you.
JoAn.